Greetings. My name is Christos Nicolaitis, and I'm the co-founder and CEO of a company that has pioneered a highly advanced clean air technology that addresses several multi-billion-dollar markets. The name of that company is Philter Technologies. Let's begin by discussing harmful air that is toxic and carcinogenic and commonly inhaled, which is a huge human health problem. Harmful air is prevalent in a variety of settings. It's a big problem in surgical settings where electrocautery and lasers are used. These devices are commonly used because they improve patient outcomes. However, everyone in that room, the surgeons, the nurses, the patient, the medical device personnel, are all exposed to toxic surgical smoke. There are several existing solutions specific to the removal of surgical smoke. However, the harmful air is so toxic in that environment that existing filters have to be replaced after just 12 to 25 hours of use. Secondhand smoke is also a widespread and pervasive problem. The harm from nicotine secondhand smoke is well documented, and recent studies indicate that cannabis secondhand smoke contains up to 4 times the harmful particulate matter compared to nicotine. This is a huge problem. Over 1.8 million people die of secondhand smoke each year globally, and in the US, secondhand smoke causes over $4.6 billion in healthcare costs each year. Another area where harmful air is an issue is in the industrial setting, where welding and soldering occurs. Smoke from soldering and welding is very harmful, and it leads to many long-term health problems. This is where Philter Technologies comes in. Our solutions for clean air are the smallest and most effective filtration technology of its kind, about the size of an index finger, measuring 3 inches tall and a ½ inch wide. We control airflow through a multi-stage process using aerodynamic principles. This is one reason it's so effective. Our technology is also malleable, which means we can configure it into different form factors. This enables us to address a range of applications, each of which has their own configuration parameters. For secondhand smoke, we eliminate the harmful air at the source. For surgical and industrial solutions, we can integrate our technology into existing solutions to improve efficacy and with a much longer filter life. The result is a healthier environment with improved economics for the end user. With the elimination of even small amounts of harmful air that is commonly inhaled, our technology leads to improved human health, lower healthcare costs, improved worker productivity, and in certain applications, it protects our children from being exposed to harmful air. Our entire ethos is around harm reduction and human health. We have built a strong patent portfolio of 9 granted utility patents, 3 design patents, and have more than 7 patents pending. And we plan to file more IP this year. Our patent portfolio has an estimated current value in the range of $30 million based on a third-party patent valuation. We have done extensive research and have published white papers on different markets that our technology can address. These white papers are available on the website at philtertech.com. Now, a little bit about our commercialization experience. We are currently in the consumer testing phase with working prototypes of the industry's first ever secondhand smoke elimination system integrated into a smoking vaping solution. And we're just a few months away from launching this. Millions of cannabis smoking devices are sold annually, and the Philter solution will be the only one of its kind in this space that's capable of eliminating secondhand smoke. Empirical data from consumers who have purchased over 190,000 of our proof of concept filters supports the adoption of our solutions to eliminate secondhand smoke, and we anticipate to be break-even by the end of 2026. The funds we're raising will support R&D of our next generation technology, which will address other applications. This is the only technology capable of eliminating high volumes of harmful particulates and smoke in a space of only 2 inches. We will bring this next generation technology to MVP status in multiple markets, and this is going to support licensing of our technology to leaders in each of the markets that we address. Along with the filing of additional IP, this is how we will continue to strengthen our strategic and competitive advantages. The revenue potential is huge. For each of these markets, a low to mid single-digit percentage translates into several $100 million to over $1 billion in annual revenues. This is what licensing partners and acquirers will use to assess the valuation of licensing arrangements or an acquisition of the rights to our technology in each market. We anticipate licensing discussions to begin in the 12 to 18-month timeframe post-funding. Our Science Advisory Board includes our co-founder and chief technology officer who has over 20 years of experience in developing life-saving medical devices and is a leader in exhalation research. Other Science Advisory Board members include leading experts in aerosol and inhalation toxicology. We also have a leader in behavioral sciences with decades of experience in the pharmaceutical industry. Additionally, the former global head of open innovations at British American Tobacco, who oversaw all R&D for over a decade, is on the board and has joined the leadership team as the company's chief innovation officer. We are actively speaking with others in the healthcare field, and this is all designed to facilitate our entrance into these multi-billion-dollar markets. Lastly, I invite you to review our website at philtertech.com, which contains more information about the company and its leadership team. If you have any questions or would like to learn more, you can reach out to me directly. Here is my email address and phone number. I look forward to the chance to meet and welcome the opportunity for you to share in our vision and take part in our extraordinary journey. Thank you.